So after understanding the scrotal anatomy, let's look at penile ultrasound, which is a less commonly prescribed investigation by the clinicians, but nevertheless, high frequency ultrasound with linear transducers using B mode, color, and spectral Doppler techniques, you can evaluate even the penis in very good way. And it, in fact, is a primary imaging modality. It allows delineation of the anatomy on B mode and also assessment of the dynamic blood flow, which is useful in patients with vascular abnormalities causing erectile dysfunction. One of the most easily available, very minimally invasive or non-invasive, cost-effective, and extremely well tolerated by the patients. In fact, today, with pharmacological induction of papaverine on all patients who have erectile dysfunctions, ultrasound with Doppler can pick up the cause of any vasculogenic impotence in penile diseases. Nevertheless, also an important role to play in penile trauma and in suspected cases of Peyronie's disease. Also, sometimes injuries to the penis can occur, and such conditions can be confidently very diagnosed on ultrasound. In fact, it can be in all emergency situations a point of care ultrasound in emergency department before you subject the patient to other modalities. Then, talking about the clinical utility, I can swear and say that today, with high frequency linear transducers, almost in range of 7.5 to 15 megahertz, you can evaluate the penis anatomy on grayscale ultrasound. And yes, use Dopplers, especially in cases of erectile dysfunctions and priapism. Coming to that, how are you going to do this penile ultrasound evaluation? Is patient lies in a supine position. The penis can be either oriented towards the feet, which is called as the dorsal imaging, or basically the penis can be oriented towards the head, which will allow the ventral imaging of the penis. No specific preparation of the patient is required other than patients when you're going to do penile Doppler studies. Coming to the anatomy, we follow the same principle from outside to inside, where there is a skin which is then covered with the dartos fascia and the buck fascia, and this echogenic tunica albuginea, which protects three cylindrical bodies, which can be seen in the transverse section of the penis, which are nothing but the two echogenic corpora cavernosa, and then below which lies the corpus spongiosum. Lying within these two corpora cavernosa are the cavernosal arteries, and there is a superficial dorsal vein and deep dorsal vein and the artery which lies in the midline here. So having said that, let's look at it on B mode ultrasound, where you can see this echogenic corpora cavernosa, each lying dorsolaterally, and ventrally lies the corpus conjosum, which is little slightly uh, hypoechoic, and you can evaluate all three very well on B mode. This is the longitudinal section through the penis and the transverse section, which also again delineates the corpora cavernosa and corpus spongiosum very well. The tunica albuginea supports and covers these structures, and it's approximately 2 millimeter thick when flaccid. And whenever there is an erection, it thins out to 0.25 to zero point 0.5 millimeter. These arteries also lie within each corpora cavernosum. And again, during flaccid states, they are 0.3 to zero point 0.5 millimeter, but during erection, they increase to 0.6 to 1 millimeter, importance of which is especially to evaluate blood flow for conditions like erectile dysfunction. So see this B mode videos of the penis where you can evaluate it on transverse section as well as longitudinally. Coming to the blood supply of the penis, there is arterial and venous supply. Both lie in vicinity of each other, especially where the venous drainage is performed by the deep and the superficial veins of the penis, while the dorsal arteries, which just lies below the deep dorsal vein, can be seen on color Doppler, and the cavernosal artery is located in the center of each corpus cavernosum. Here again, a point of note is that normal cavernous arteries shows a systolic peak between 11 to 20 centimeters per second. Coming to the penile abnormalities at glance, there can be non-vascular etiologies versus trauma, infection, and tumors, which all can be evaluated confidently on ultrasound. And one of the commonest indication of non-vascular cause is Peyronie's disease, which is the uh, 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 cause of curving of the penis, which can be picked up on ultrasound. Trauma, yes, there can be fractures of the penis, hematoma because of fractures. Infection of the penis can be picked up very, very well. Sometimes there are tumors which can be benign and malignant, which can be seen very well on ultrasound. Then a huge role of ultrasound with color Doppler, especially to find out cases of priapism and erectile dysfunctions, both which can be evaluated with penile Doppler studies. So see this beautiful case which I want to share, where the patient was a diabetic and he came with some issues of erection and curving of the penis, which he noticed, and how beautifully on ultrasound you can see this echogenic calcifications which are seen in the tunica with albuginia, and this is nothing but the Peyronie's disease. So Peyronie's disease, usually commonly seen with diabetics, can be evaluated very well on ultrasound. See this case who has a sexually transmitted disease, and this was a clinical picture of the same patient had inguinal nodes, and this was a penile condyloma which showed a large mass at the surface of the penis, echogenic fine calcification, highly vascular ultrasound, and on this on histopathology was penile condyloma. Then talking about trauma. So see this beautiful case which was given by dear Dr. Ravi sir. And here you can see that there is disruption of the tunica albuginea, and there is complete disruption, especially on the left side. And you can see a hypoechoic collection. It is nothing but a hematoma and disruption of the tunica albuginea, giving us a confident diagnosis of penile fracture. As again, see this right corpora cavernosa, which is completely normal. So penile fractures can occur as a result of trauma, or also I've seen cases where inadvertent sexual activity leads to the same. Then a huge role of Doppler to pick up arterial inflow and venous outflow obstructions, which all can be beautifully picked up by intracavernosal injection of papaverines to induce an erection and assess the hemodynamic response. I don't do penile Doppler studies much, and therefore I have limited knowledge about the same. But yes, I always do refer patients to my colleagues who do this penile Doppler studies. Ultrasound, as I told you in our previous case, can pick up penile fractures and also differentiate low flow ischemic states from high flow priapism by analyzing blood flow patterns in the cavernous arteries. Few important take homes which I want to tell you is that penis has a lot of superficial structures, so use lot of copious amount of gel as a standoff pad, because if you do undue pressure on the skin, it minimizes the compression on the superficially located dorsal vein. So do always the ultrasound with minimal compression, because any kind of firm pressure can impede blood flow and affect your accuracy of velocity measurements. Also, today with vasoactive agents like papaverine, you can pick up all cases of vasculogenic cause of impotence in a very, very good way by doing penile Doppler studies. In fact, now penile Doppler ultrasound is called as a hallmark of a silent coronary artery disease in men presenting with erectile dysfunction, because now erectile dysfunction is a reported marker of endothelial dysfunction and an early manifestation of cardiovascular disease. Thank you about